So we are now being recorded. Hello. Agenda for today, opening circle is a little bit of kind of what we just did, and we'll do a little bit more in just a bit. The topic is adapting your communication strategies during the COVID-19 pandemic. How do you pitch your prevention story to journalists? How do you adapt your prevention story? So this is part of a series. We spoke about social media last time on, I think it was the 16th, and now we're talking about journalists, and we're going to keep the conversation going also on how do you develop a communications plan. So write down your ideas, questions that come up so that we can integrate that into our next conversation. We've introduced our presenters, Jessica Merrill from the partnership, Pamela Mejia from Berkeley Media Studies Group, Carissa Gutierrez from Calcasa, and Yomara Lopez from Univision. We will have time for Q&A, although you can also type in your questions as we go along into the chat, and then have a discussion also about what's coming up for folks as we go through this conversation. So for our opening circle, if you wouldn't mind typing into the chat, we'll also open it up for folks, but the chat lets us know who is on here. Type in your name, pronouns, agency you're representing, and where are you? And then I would love to hear if you wouldn't mind typing in, like, what grabbed your attention about today's topic, the communication strategies. If you wouldn't mind adding that into the chat. And then if any of you want to speak up and share out loud, please do so. So who is here? What brings you to this conversation? Yeah, who wants to say hello out loud? Any brave preventionists?
I'll say hello.
I'll say hello. Oh.
Yeah, we've got two. Go for it.
Go ahead.
Hi, I am Rebecca Swafford. She, her, hers. I'm actually joining you all from North Carolina. I'm with North Carolina Coalition Against Domestic Violence, also a grantee of Delta. So that's how I got connected to this. And really, I'm curious about hearing folks' experiences with working with journalists. I have done some prevention messaging through social media and other places, but not so much with journalists at this point. So really, I'm just curious about this as another strategy to get messaging out to North Carolina.
Thank you so much for joining us. It's great to see you here.
Thanks for having us.
Hi, everyone. My name is Delphine Burns. I'm the communications lead at Monarch Services in Santa Cruz County in California. And my pronouns are she, her, hers. I am joining today because it's really awesome to have just like a communications specific webinar. I handle all communications things at Monarch, and so since it's sort of like I'm a team of one doing that, it's really cool to be able to bounce ideas off of people here. So when I saw this webinar, I just thought it was really perfect. And in the past few weeks, we've been engaging a lot with media and with press because of the unfortunate uptick that communities have seen in domestic violence. And we've been receiving a lot more crisis line calls as well as new domestic violence clients. And so I've been doing radio interviews and interacting with the press a lot. So I just was interested in hearing more thoughts on best practices as far as pitching and just interacting with press in general. I used to also be a journalist myself. So I'm just, this is really interesting to me and really perfect.
Thank you so much for being here. Thank you for sharing.
Thanks for having me.
Who else? Who else, anyone want to say hello out loud? I know we've got folks typing into the chat, but just want to open it up if anyone wants to say hello out loud to everyone else.
Oh, yeah, about communications and stuff. Yeah, I hope so.
Oh, I hear. Ruby, are you getting ready to say hello?
I
was, but I was like, wait, I should wait and see if that other person was trying to talk. I was actually in a chat box typing out my answers, but I was like, it's so much faster if I just say it out loud. So hi, my name is Ruby. I know a couple of you because I've been in prevention work for a couple of years. So depending on when you met me, you might think I'm at another agency. I am now at SAVE in Fremont as of the beginning of the month. So last month I was with YWCA. Now I'm with Safe Alternatives to Violent Environments in Fremont. Pretty exciting change. So my pronouns are she, her, hers. And what I was interested in learning is just how everyone else is using the media and how they're leveraging it to raise awareness or just kind of get a little bit of feedback about what everyone's experiences are. I've never actually worked with media in my own prevention work. I have in my personal life only because my mom works for radio stations and she's a radio host. So I'm familiar with radio, but only that's kind of the only thing. So other than that, I just kind of wanted to learn how everyone else is using it, like what are the best practices, and kind of hear about everyone's experiences.
Thank you so much. Glad you're here. And congrats on the new position.
Thank you. So new to this change.
Yeah. Good. It's important to recognize that when we need a change. We also have, I don't know if he's brave to say hello, or wants to say hello, Patrick Cook from the CDC Violence Prevention Technical Assistance Center. They're based in Washington, D.C., and he is working with a lot of us on developing our social marketing campaigns. So I don't know if Patrick wants to say hello to folks.
Sure. Hi, everyone. It is Patrick, and I've been madly trying to change my profile picture because that's from my other life where I'm also president of the International Social Marketing Association. So I'll show you my face in a second once I get the background cleaned up. I am joining as one of the communication specialists from the CDC's Violence Prevention TA Center. We're a group of folks working with a lot of you in California and across the country, working currently doing some work with Alaska around this particular issue. So it was a real, really wanted to hear some of the experiences that you're all having so we can share it across the network.
Thank you for joining us, Patrick. Anyone else want to say hello in the opening circle? And thank you for typing into the chat. We really appreciate it. We have people from all over the state today. And again, our guests from across the country. So thank you for being here. But just want to open it up. Anyone else want to say hello out loud?
Hi, Alejandra, Meghna here. Good morning.
Good morning.
Hi, I can see so many familiar faces. So it's happy Friday. I mean, I'm already saying happy Friday, even though it's Thursday today. So it feels that kind of week. Anyways, I'm Meghna Bhatt from the California Coalition Against Sexual Assault. And I know I already typed, but I just wanted to say a quick hello to everyone. And I think I'm more interested in being a part of this discussion and webinar is I'm interested in the storytelling component of how to use storytelling to, convey those messages to our audiences, especially when we are providing TA to our member agencies. So I'm excited to hear more, and thank you for organizing this.
Thank you for being here, Dr. Bhatt. I love it. I love that you're here. Thank you. And I love to have you back at Calcasa. Congrats. Love to see you here. So we are going to go ahead and get started. I am going to stop the share and give Jess an opportunity to get her PowerPoint loaded. While she's doing that, just so you have some information on the background also of this topic. I did work at a dual domestic violence rape crisis center in San Diego. Many of you know Center for Community Solutions. And we took the opportunity to meet with journalists and have conversations as well. And it's tough. Where do you start I'm very thankful that Jessica had a relationship with Univision here at the partnership. But what happens when you don't have a relationship that's there? How do you foster one? How do you develop one? And then how do you frame your communication strategy for a newspaper or for television? What happens when they ask you a question and you have no idea what to say? So all of these items come up. And also we know that a lot of times it's usually the executive director that steps forward and does these conversations. And we're really wanting to build leadership and strengthen the skills that you all have so that you are able to get in front of that camera, so that you are able to write up those op-eds or those articles for the newspaper. So that's what today's about. So let's hope that we get some of your questions answered. And yeah, I'm stoked. So let's go ahead and get started. Jess, I'll hand it over to you.
Thank you. And first up is going to be Pamela Mejia from Berkeley Media Studies Group.
Okay, great. And Jess,
okay?
Excuse me?
Can you see my screen okay?
I can. Thank you so much. Jess has very generously agreed to move my slides for me, so I will make sure to flag when I need to go to the next one, Jess. Thank you. Well, good morning, everybody, or early afternoon, depending on where you are. As was mentioned, my name is Pamela Mejia. I'm delighted to be here. I'm head of research at Berkeley Media Studies Group. And I have been at BMSG for about 10 years. I've also been lucky enough to be on the board of the California Partnership to End Domestic Violence for about the last 4 or 5, somewhere in there. And have been working extensively with CalCasa for more than 6 years. So delighted to, have and continue building these relationships with folks. I see in the chat box a few people have already possibly heard me say some of these things before, and it sounds like it was impactful, which I love to hear. I was grinning like a loon over here when I read that. So what I'm going to do today a little bit, just I'll share a little bit about BMSG and what we do, and then I'm going to dive into some overarching ideas about kind of structuring and framing communications. Before I stop talking, I'm going to try to keep this fairly brief so that we can really get into the meat of what pitching a reporter, what interacting and engaging with a reporter looks like, what putting these kinds of recommendations into practice looks like in your daily work. So Jess, if you want to go to the next screen, or next slide, excuse me. Thank you. So just a quick note for those of you who haven't seen or heard BMSG speak before, Berkeley Media Studies Group, we are a very small nonprofit, a project of the Public Health Institute, and we're based in Berkeley, California. I'm coming to you today from my home in Oakland, California, the Bay Area. And the work we do is threefold. So at BMSG, my team leads research on news coverage and other kinds of media narratives about public health and social justice issues. The goal is figuring out who's part of the story, who's missing, what are the opportunities to lift up prevention. We also provide media advocacy training and strategic consultation for community groups, researchers, public health advocates, anybody who wants to get better at communicating and using the news more strategically. And finally, we provide professional education for journalists, equipping them with tools or connecting them with sources who can help them tell stories that talk about prevention as well as intervention, that talk about solutions, that bring community voices forward, et cetera. We're often asked at BMSG why we focus at the news, although maybe a little less so now than in years past, because we know now more than ever that the news shapes what we think about, what we're not thinking about, how we think and talk about different issues that face us. And it also has a huge impact on the decisions that we as voters, we as advocates and practitioners, and our policymakers and our opinion leaders make. So the news is a powerful, powerful tool. And one of the questions that we tend to also think about a lot, especially on the research side, is, well, if people only knew about this issue, let's say here sexual and domestic violence through the news, what would they know and what wouldn't they know? And one of the things that I know from over 10 years of researching all kinds of violence, but especially sexual and domestic violence in the news, is that prevention is usually absent from news about domestic and sexual violence. But lately, continually, but certainly lately more now than ever, we're seeing folks really working to engage the news and the media around bringing that prevention voice forward, which is really why we're here today. So overarchingly, I also want to say we've used the phrase media advocacy a lot, and I want to give a little bit of grounding for what I mean when I talk about that. We talk about media advocacy a lot at the MSG, and Jess and Alejandra and I talk about it a lot as well. Jess, do you mind moving to the next slide? So just to give some context for what I'm talking about when I'm talking about media advocacy, which comes up again and again, and what, again, the focus and the crux of what we're talking about today. Media advocacy is really the strategic use of mass media, which can be anything. It can be print, TV, radio, social media, blogs, all the different ways that we communicate with one another now, to support organizing and advocacy efforts to make systems change happen, whether that's policy change or programmatic or organizational. It's just one part of what what it takes to.
Yes.
Uh-oh, do I hear a baby? Sorry. It's just one part of what it takes to make things happen that we need to ensure that our communities are healthy and safe and just. But it's always tied to our larger work, to whatever else it is that we're doing to make communities and families healthier and safer in our own practice, our own lives, our own policy efforts. So media advocacy is essentially just about supporting the work that you're doing on the ground by leveraging the media, especially the news media, to really generate news attention, put pressure on decision makers, and really bring forward the kinds of solutions that we want to see that are often left out. And what I know right now that's happening, especially in the time of COVID when we're all trapped at home, is that we're still seeing, even though we're very maybe limited in the ways that we can communicate, preventionists are doing incredible work, as with traditional and especially with social media, that are really ramping up media advocacy strategies and keeping prevention in the forefront, even as our news and our media environment is swamped by COVID, and even as the tendency is to pull back from prevention. So I just want to kind of reiterate here that your work is newsworthy, it's noteworthy, it's important, and one of the reasons for today's conversation is just that we want to lift up that it's important, that we want journalists to know about it, and we want to keep supporting you in making that work visible, and pitching and building relationships with reporters who can make it more broadly visible. Okay, so that's my little kind of talk through about what media advocacy is and why we're here. And again, it's just a huge thank you for all the work that you're doing, and a little context setting for what we're hoping that we can support you in today. And now, kind of with that in mind, I just want to give what I call my 5 principles of communicating strategically about prevention. And these are just some kind of framing things to keep in mind as we're putting into practice and as we're thinking about the kind of really tangible next steps that the partnership and Talkasa will be talking about next, and that also our Home Univision will also be talking about. So Jess, if you want to move to the next slide, I'm sorry. Okay, so the first thing I want to say about strategic communication is that we need to know what we want to change. No, we never communicate just for the sake of communicating. We're always communicating in the service of whatever our larger goal is in the context of media advocacy, the larger change that we want to make. And so Jess, if you want to move to the next slide. And so what we always say at the MSG is that message is never first. People often want to really start with thinking about, what outlet do I need to reach, or what do I say when I get a reporter on the phone? And what I want to kind of urge people to remember is A, message is never first, and B, before you know what you want to say or where you want to say it, you have to know what you want to do. You have to want to know why this communication is happening, why this article, this op-ed, this letter, this interview is important. And the most critical part then of strategic communications is just really backing up and thinking about the goal. And the goal is a big part of what we call your overall strategy. And that's why we always say at the MSG, if you've ever heard me talk, you've heard me say this 1,000 times, so I apologize for those for whom this is old hat. You can't have a media strategy or a message strategy without an overall strategy. All right, so what do I mean by overall strategy, message strategy, media strategy? Jess, do you want to move to the next slide? So this is another image that you'll see a lot if you've ever really worked with the MSG or with any of our partners. I know that Carissa and Jess and Alejandra, you've seen this a million times because I use it so often. when we talk about these different strategies, you can think of it in terms of layers. The first, the overarching layer is going to be, again, that overall strategy that depends on answering questions like, what's the problem that I'm trying to solve in my community, in my state, in my town, in on my block, wherever your sphere of influence is. It's about clarifying what your goal is. If you have a policy goal, what does that look like? If it's about the way that an institution does business, what's that goal look like? I use policy sometimes, but that can be shorthand for all the different kinds of changes that we're trying to make and all the different work that we're doing to make our communities safer, to support survivors, to prevent violence from happening in the first place. Overall strategy is also going to be looking at questions like, well, who can make the change? You know, if I want to see a change happening in my school district, who do I need to reach to make that happen? If I want to see something happening in my town, in my community, in my county, who is my, I hate the phrase target because for me it evokes violence, but who is my intended audience? Who do I need to reach to make this change happen? Overall strategy is also going to be about thinking about who in your networks you need to enlist. Who are my allies? Who are my people that are going to show up at my policy day, right? Who am I going to be engaging with to make this, to raise the voices needed to reach the goal, to reach the audience that we need to get to, and to make that change happen. And finally, it's also thinking about what are the actions I want to take. Right now, a lot of the actions we're going to be talking about and thinking about are going to be virtual ones. So what are the things that we need to do to reach those intended audiences and activate our allies and make that change happen wherever it is that we see it? Those are just some of the pieces of overall strategy. And again, that's really where we encourage people to start with. Before we start thinking about what we're going to say, what reporter we're going to reach out to, what outlet we're going to connect with, all these pieces of media and message and access strategy, think about those big questions of what do we want to change and who has the power to change it. Jess, do you mind moving to the next slide for me? Thank you. So here's another, the second of my 5 principles. This is one that I say so often, sometimes I dream about it. Sometimes now my 9-year-old daughter says it, even though she doesn't understand what it means. You can't be comprehensive and strategic at the same time. So in trying to communicate about how big and how important preventing sexual and domestic violence is, it can be super tempting when we have the opportunity to speak with a reporter, to speak with a funder, to speak with whoever, to say every single thing that we know, to flood people with statistics and data, to talk about everything that we can to illustrate the scope of the problem. And what I encourage folks to do is really try to resist that urge, because again, it's impossible to be comprehensive, that is to say everything, and be strategic, that is to say what would need to be said. I love Alejandra here in the chat box, at the same time. So what I encourage folks to do, what we encourage folks to do is to think about how we can talk about the problem in a way that's clear and understandable by focusing on the aspect you're most directly working on right now. So we can decide what piece of the problem we want to highlight, which depends on our overall strategy, the change we're trying to affect right now. And then that doesn't mean you have to ignore all the other big pieces of the problem that are out there, but it just means it's focusing one at a time, depending on what you're trying to accomplish now and what sort of your immediate and next step goals are. So Jess, if you want to move to the next slide for me. So one way that I encourage people to check if they're being comprehensive, or excuse me, being strategic rather than comprehensive, is to make sure that your problem and your solution line up. So, right, if we're starting with thinking about what we want to change, say I want to increase funding for counseling or for health relationship education, say, in my school district. Then I want to go back to how am I defining the problem? Well, if I'm saying there's too much violence in the media, and my solution then is I want more healthy relationship counseling in school, this is an example from a real training I was at, there's a disconnect, right? Too much violence in the media is not necessarily a problem that counselors doing healthy relationship training in my school district are necessarily going to be best equipped to address. How can I then redefine my problem so that I'm focused on something that makes my solution the logical endpoint? So just, do you want to click one time? So, and one more time. I built an animation in before I remembered Zoom doesn't love PowerPoint animation. So what I encourage folks to do, again, is to start think about your solution, think about the change we're trying to affect, and then walk backward to think about how we can define the problem in a way that makes sense and, again, cues up your solution as the most logical one. That's a way of ensuring that we're being specific, that we're being strategic, and that we're not necessarily trying to be so comprehensive that we're covering everything and going so big that our solution gets lost. So again, one kind of tip and tool I give people a lot here, and I'm going to encourage it, and I'm happy to talk more about how to do it, is to start from the solution and then work backward from there to how we define the problem and how we think about articulating that to whoever our audience is. Again, can't be comprehensive and strategic at the same time. Jess, do you want to move to the next slide for me? Okay. Third principle, we're about halfway there now, folks, I promise, is thinking about the landscape. I say all the time, illustrate the landscape. I'm no artist, so I'm going to give you a little bit more context for what I mean by that. Jess, do you mind flipping to the next slide? So what I want to talk a little bit about here, when I talk about the landscape, or portraits and landscapes, you'll hear me talk about both. What I'm really talking about is framing. And framing is a phrase that gets tossed around a lot. Many people here may have heard it, may have used it. So to give a little bit of background to the way that we at the MSG and people in kind of media and communications tend to think about framing, frames are the mental structures that help us organize and understand the world. There's no blank slate, and whenever people receive information, they fill in the blank, or they build the rest of the puzzle out based on their own understanding, their own default frames. And we know that in the US anyway, one of the default frames that people tend to go to immediately focuses on personal responsibility, right? So when people hear most information and what their general default tends to jump to is that if people succeed, it's because they tried really hard or they were just a good person. And if people fail or experience trouble or struggle, it's because they're a bad person or they made a bad choice. Right? That's the frame people tend to go to. That's the reason I use this train image is frames are like tracks for trains of thought. And when people get on them, it's hard to get them off of it. So often as people in this room know probably better than anyone else, when people hear or think about sexual and domestic violence, one of the first things they jump to is, well, why didn't that person leave? Or, wow, the person who did that must have been a really terrible person and just a monster, somebody not like anybody I could know. Or, wow, that person must have been raised wrong, or that person must not have been a very good parent, right? So the default tendency, the track that people tend to go down immediately is towards personal responsibility, personal choice, blame, and shame. And so the problem, what we encourage people to do is to then think about how can we give them another track? How can we get them onto a track or a train that leaves room to talk about the bigger environment? The environment that goes beyond personal responsibility, but also thinks about the systems and structures we live in, the bigger places where things happen, the places where intervention and prevention are possible to ensure that people don't get hurt in the first place. Let me take a little step back and realize that even as I say this, it's still a little confusing in the context. I've been talking about portraits and landscapes and trains. I'm all over the place with my metaphors. So let me go to my next slide and say that the way that this works out when we're talking about journalism, when we're talking about the media, is that there is the difference between a story that's framed like a portrait and the story that's framed like a landscape, right? So overwhelmingly, stories that appear in the news about sexual and domestic violence, any kind of issue, are framed like portraits. They play right into that personal responsibility frame. They emphasize individual cases and crimes. That tells us a lot about what happens in a particular incident of violence. It doesn't tell us a whole lot about the world outside of it. About 80 to 90% of stories about domestic or sexual violence tend to fall into that very narrow portrait frame, because again, that's just the way that we tend to think and tell stories of people. Only about 10 to 20% of stories take a bigger landscape frame. That is, they might talk about an individual person or story, but they nest it in that bigger landscape, the bigger world where violence happens, so too can prevention. Right, so these are examples from the news recently that show what a typical portrait story about domestic violence looks like, and maybe a more typical landscape story, a story that might talk about an individual incident, but it also paints a picture of the bigger world around it. News framing matters because it affects how people think and talk about problems and solutions. Jess, do you mind flipping to the next slide? So when people see those portrait stories, the ones that zero in on just one individual case or crime, and then they're asked to tell us what caused the problem or who solved or what caused the problem, they go right into that personal responsibility frame. They say, wow, well, she should have left, or his parents should have raised him better. They default right into personal responsibility. And then when you ask them what should be done to solve the problem, they tend to default right to punishment and blame and shame and individual actions that can lock people up. So Jess, do you mind clicking one time again? I messed up my little thing. Okay, right. So again, we know that when people see stories like this and we ask them about causes and solutions, they go right into that default personal responsibility train of thought. On the other hand, when people see stories that paint a bigger picture, that bring the landscape forward, just if you can click again, they're more likely, when asked about the cause of the problem, they might talk about personal actions, but they also might talk about some of the systems and structure around that person or around that family or around that incident that might have contributed to the problem. And even more importantly, when you ask them to talk about solutions, then they start thinking about, well, what could the community have done? Or what could have our systems done to help intervene or help prevent this problem? So ultimately what we know is that when we frame our stories differently, we can help our audience to see solutions that they might not have seen before, including preventive solutions. So briefly, Jess, if you want to go to the next slide, I want to encourage folks, I want to ask folks, what are some ways you can illustrate the landscape and as you think about how to talk to a reporter? And what kinds of pieces of information do you want to highlight to show that prevention is possible, that prevention is happening, that you're doing it? Oh, I hear my sound is getting a little choppy, and I do apologize for that. So if there's anything that people need me to repeat, please let me know. But I want to ask folks again, as you're thinking about the pieces of illustrating the landscape, thinking about what pieces of information you want to highlight that show that domestic and sexual violence are community problems with community-level solutions. What do you want to show? What could you bring into your story or into your pitch to a reporter that could help illustrate that and show prevention? Anybody want to put something in the chat box or say anything out loud? Okay, well, it's a lot to think about. So I'm gonna let people sit with that for a second, but I'm gonna move on. We still have two little bullet points I want to hit before we move out of this and hear more about what this looks like in practice and what Jessica and Carissa's experiences have been. And Alejandro, please do flag me if my sound keeps getting choppy. I'm gonna make sure to hold the phone closer to my face. So the fourth piece I want to just highlight is that it's really important to elevate shared values. What does that mean? Well, Jess, if you can flip to the next slide really quick. Thank you. When we talk about messages, the things we say, what we, once we figured out what we want to change and who we need to enlist and who our audience is, we want to think about what we want to say. I always encourage folks to remember that there's three basic components of a message. There's the problem, there's the solution, and then there's the value dimension. The why does it matter? We know, first of all, that we tend to focus more on problems and solutions, and that's something I encourage folks to think about how we can flip. It's important to talk about the problem, but it's also really, really important not to get lost in just the details of the problem and to lift up what's working or what's the solution that can help address that problem. But even more importantly, I want to encourage folks to think about the why. The why does this matter? Because values are really what's in our heart. And that's what activates people. People tend to make decisions from their hearts rather than their heads. So values can help engage people. Values can help motivate them. And they can help spark people into action. And I would say that I'm in a room, lucky enough to be here in a virtual room with people who are really good at activating values. I think the partnership and Calcasta and many of the groups that are listed here, in the communications I've seen from you and the work I've done and the work we've done together, I've gotten to see that highlighting values like interconnectedness, like prevention, like protection, like support and community, those are things that tend to really come up a lot in the communicating we do. So people are really good at this. I just want to encourage you to keep doing it. and do it more if you can. So when I talk to people about values, sometimes the question is, well, what values should I highlight? And what I tell people is always to think about the values that motivate you, the ones that feel really organic to you or to the messengers you're working with. And also you can think about your audience. You know, for some audiences, values like common sense or financial stewardship might make a lot of sense. Whereas maybe for other audiences, things like social justice values might make more sense. So as long as the value feels organic to you, you can kind of think about highlighting different values for different audiences and in different contexts. I just say that because sometimes I talk to folks who say, hey, I'm in a really conservative part of the state, or I'm working with folks who I really don't think are on the same page with me about, this particular kind of value, but they're really kind of, concerned about spending and financial stewardship and resources. I said, well, that's a value too. So how can we think about how to highlight, common sense or some values that might connect better with the audience that you're working with, as long as they're also really true to you and true to what you care about. So I want to, if you don't mind flipping to the next screen, I want to ask folks here, Justin, thank you. Just asking, and feel free to say it out loud or put it in the chat box or to think about it yourself. The values that motivate your work, which are the ones that you tend to lift up or that you want to lift up more. There's so many. And, I think one of the things that I found really powerful right now in the moment that we're in is that this crisis has illustrated the extent to which we are all interconnected, to which any of us doing well depends on all of us doing well. And that seems to be a really resonant value right now. So I just kind of want to lift that up in the moment that we're in. But does anybody have any other kind of values or thoughts or motivating sparks that they want to highlight that really are grounding their work or that they're really feeling inspired by right now?
I can share, Pam, if you'd like.
Of course.
Yeah, I'll make it quick, but yesterday, as many of you know, we were part of many legislative meetings, and really the common goal that our audience was the policymaker, the legislator we were speaking to, and the common goal or the common value was that we both wanted or agreed that we wanted to live in safe and inclusive communities because there were these unintended negative consequences, and how does prevention work into that common value or shared value? And so agreeing that we are both on the same team, we want the same thing. And this is what it looks like. And this is why we can count on your support for this. But the values that motivate our work are really defined by something as broad as a safe and inclusive community. And CalCASA, and I know that the partnership as well, has gone about the business of creating a theory of change. And going through a process or exercise like that really does magnify or highlight what the common values are that we are trying to promote in the work that we do, and sharing that with our staff as well.
Fabulous. That's a great example, Clarissa. And I see another in the chat box too, transparency and accountability, right? Yeah. So again, thinking about all these different values of community, of accountability, of stewardship, of what's called Sankofa, the wanting the next generation to do better or to have better than the previous one did. Equity and justice, safety. Oh my gosh, safety, such a powerful value, one that really crosses a lot of barriers and a lot of lines. So many tremendous values. I usually find that this is the easiest bullet point to raise because people are already doing this and doing it well, but I just want to lift it up. I want to just, again, make the comment that we're in a moment where some of the values are seem more visible than ever because of the moment that we're in.
And can I just add to what you said? And I think I think it's so important right now, especially with reporters. We have social responsibility right now, and it's really hard for us because we cannot go out anymore. So I've been working from home, and I feel like people want to know information, especially people that they have lost their jobs. And I'm finding myself questioning the governor so many times. He has mentioned in the past that the undocumented community is going to get help, but we're getting from the undocumented community that the help that the governor is trying to give them is not enough. So I feel like what motivates us as reporters right now, it's trying to be the voice for those people, try to question the governor, about what he's trying to do to help those who sadly don't have documents and are struggling right now financially and also emotionally because of coronavirus.
Great point. I love having this room of folks together too. It's so it's fabulous having like journalism and advocacy and community and researchers and just so many people in the same space to kind of talk about and triangulate for these ideas. Fantastic and great points being raised in the chat box too. Fairness, justice, hope, all of these. Okay, I want to get to my last bullet point, and then I want to make sure that I stop talking. I love to talk, but I also love to listen. And I want to say, just on my last note, the messenger matters. You've heard me talk a lot today about your speaker, whoever's talking, and I just want to say, the audience that you're talking to matters, but so too does who says your message, who conveys it, who makes your pitch, who stands in front of the reporter or in front of the microphone or at the city council meeting or in the legislative session or wherever else. I want to, do you mind moving to the next slide, Jess? We know that audiences are most likely to believe in and identify with and connect with speakers, or connect with speakers that they identify with, in whom they see themselves in some way. And so that might mean that as you're thinking about who to make the pitch or who to see the interview, you might want to think about different people for different kinds of audiences. And the possible combination of messengers is what we call the messenger mix. So, and again, we know that that there's lots of different people in different networks, and so one of the things we really encourage, or that you might want to think about as part of your overall strategy, is who you can activate. Who are some of the folks that are well equipped or ready or prepared to become spokespeople, to become people who can give a voice to your work and why it matters. And of course, we know that speakers from a range of different backgrounds are really important. But the one thing I also want to flag, and I hope that this is a helpful nuance that we found, especially talking about sexual and domestic violence prevention, everybody has a lot of different identities that they carry with them. I'm a Latina, I'm a mom, I'm a researcher, I was a single mom, lots of different things about myself. I don't know, I'm a Berkeley grad, any number of other things. And as we're thinking about whoever your, I see a go Bears, whoever your messengers are, thinking about how they fit into your overall strategy, who your audience is, what you're trying to accomplish, there may be elements or there may be some aspects of their personality that they particularly want to lift up to highlight how they connect with or what their identification point is with their audience, right? So perhaps if I'm talking to a group of Cal students, I want to talk more about my experience as a survivor on the Cal campus. But if I'm talking to my daughter's school board, I want to highlight my experiences as a parent in Oakland, right? Those are all facets of my identity, but the ones that I lift up in my messaging to connect with my audience are going to be really important. So thinking about not only your messenger mix, but the different identities that messengers that we all carry with us, and the ones that we may want to think about how to lift up in communicating and in building that identification with our audience. So with that said, go there. And Jess, if you don't mind moving to the next slide. So as I would encourage folks today to think about your messenger mix. Who are folks in your agencies and your networks and your communities who may be ready and willing and equipped to become part of that mix and to become part of that communicating strategy. Because as we know, the messenger matters. So the last thing I'm going to say, if you can just go to the last slide for me, is that I'm delighted to talk about all these things all the time, but I want to stop now. I just want to give my contact information, though, and I'm still going to be here for the rest of the time to chat and to listen. So thank you so much for hearing me out today, and I'm excited to do this work with you and really honored to be here.
Thank you so much, Pam. That was awesome. I have a lot of questions, so I want to encourage everyone, as Jess is getting set up for the next part, that you add your comments, thoughts into the chat. What are items you want to highlight? Again, what are the solutions that you want to showcase so that we can continue focusing on some strategic messaging? Yomara.
Yes.
It's your turn. Te toca.
Yes, I'm excited. Well,
do you want to share your screen or?
You know, I was having problems doing that, so I'm just gonna go ahead. I was able to get it on my phone, like the topics I'm gonna talk about. So I'm just gonna, you guys are gonna have to deal with my face and nothing else the whole time. So I promise.
I love it.
I'll be entertaining. But thank you so much for the invitation. I'm just really happy because I get to share what it's like to be a reporter and do stories. So a little quick bio about myself. My name is Yomara Lopez. I'm a reporter with Univision here in Sacramento. I've been here for about a year and a few months, and I was coming from Austin, Texas, which was my second market, but I grew up in Miami, Florida. I was born in Colombia, so I've been all over the place. But I love the fact that people here in California, especially in Sacramento, all these organizations, they really do worry about people that need help. And that's something that really does inspire me, which brings me to what I do and why I do it. So my whole point of being a reporter is being the voice for people that sadly sometimes are afraid to have a voice, whether it's because they don't have documents, whether it's because, you know, they are not really familiar with the language. So those are the kind of stories that I tend to do more, especially because of everything that's been going on with immigration, obviously now with coronavirus. So it's just a lot of things that people have been dealing with. But basically what we do in the mornings is we have an editorial meeting, and I try to have at least 3 to 4 story ideas that I feel will be very helpful for the community. And what I tend to do is bring out issues that are important. And like Pamela was saying, we wanna present the problem, but at the same time, we wanna present the solution. And that's really important. And that's why I think it's important for me to go out there. When I was able to go out there in the streets and find stories, real stories of people struggling, because that really does show other viewers, you know, this is real, this is happening. And maybe they could be going through that stuff as well. And that could be also be a lesson for the viewers to learn. And that's what I think having an organization that perhaps right now will be domestic violence, that it's giving us information that we need. I think it's so valuable because there are thousands and thousands of people out there that are watching our newscast, and they're just afraid to say, hey, listen, I have the same problem and I need help. And that's why being in touch with organizations such as, you know, you guys, I think it's amazing, because sometimes we get to hear things that we don't even know, because you guys are on a daily with the community. You guys are in a constant communication with them. And to us, that means a lot, because we can bring those problems out on the screen and help others that are probably going through the same thing and they don't want to speak up. So let me just see my other pointers here that I had for you guys. So I know that sometimes it's just really hard. I know we've done a few stories with Alejandra, and sometimes it's really hard to bring that person who has been affected and tell her story to us. And I think that does make a big difference instead of just doing like an informative piece story. And for example, now with coronavirus, we've been struggling trying to get people to tell us their problems, because one, we cannot go out. You know, we have to base everything on the context we have on social media. And sometimes you have to be careful when you are reaching out to people on Facebook, because sometimes they could be lying to you. You know, some people want to make up a story saying, you know, I'm going through this, I'm going through that. So I feel like as reporters now, we're struggling trying to find those people that can tell us what their problems are. But it's just about questioning. It's just about, you know, you want to be a report that has credibility. So obviously you want to make sure that, you know, the person that you are using to show an example is a legitimate person and that is showing these problems to you. So I feel with coronavirus right now, we're getting a lot of unemployment problems. People are losing jobs, getting their hours cut shorter. And then we also have an issue that personally has been affecting me the most, which has been victims of domestic violence. And we know that right now, through this time, they're having it tough. And I believe I did 2 stories or 1 story with Alejandra, and Jessica is always helping me with this. Because we were getting calls from the Stockton Police Department saying that they had seen an increase in calls of domestic violence. And they said that, now that people have to stay in home, it's a perfect time for the abuser to get control of the victim, to abuse the victim more. And then sadly, sometimes we have kids involved in this. So I wish that, to be honest with you, I wish I can do stories like this more often, and we can provide them resources, places where they can call, and if they don't feel safe, where they can reach out. But sadly, we have so many stories about coronavirus, about information they need, governors talking every single day about the updates. But I just feel like I was able to do this domestic violence story a few weeks ago, and we got really good feedback, because what's happening is that these women that are being abused, they're afraid to leave. Now their escape plan, it's no longer working, because the abuser might be at home the whole day, because the abuser might be working from home the whole day. On top of that, it doesn't help that some of these women are undocumented, and they're afraid to reach out to an organization or to the police, because they're afraid that, ICE is gonna come in and deport them. So I feel like undocumented women or undocumented victims of domestic violence are the most vulnerable ones, just because they feel like they have all of this against them, and their abuser actually uses that to threaten them, to scare them. If you talk to the police, or if you talk to this organization, I'm gonna kill you, or I'm gonna deport you, or I'm gonna, report your situation to ICE, and then I'm gonna have them deport you. So I feel like those are the people that I worry the most. And that's why I think it's important for organizations such as the Domestic Violence Coalition to let us know, hey, listen, we have seminars. And I love the fact that Alejandra and I did a financial seminar a few months ago. And we talked about the importance of being financially dependable on yourself, being independent from other people. And I think that really made a difference, Alejandra. We got, I think you got a lot of calls from people interested, because I just feel like that does make a difference. And sadly, I have to say this, because I've done so many of the stories, that it's a cultural thing. Sometimes it's a very cultural thing in Hispanic families. If your boyfriend beats you up, it's okay, suck it up. I mean, if you're the wife, then that's your husband. You have to deal with it. And I'm finding a lot of these stories when I talk to women that have been victims, and they're now survivors, that they just thought it was like a normal thing to do for a husband to beat them, or they deserved it. So they've been brainwashed. And that is something that being a reporter, being in this position, I'm willing, and I'm gonna keep working really hard to change that mentality, especially in our community, because we need women that, are strong. And I believe we all have it inside. It's just that they have been brainwashed by these people. And especially, in this time of coronavirus, I feel like they are just going through so much right now. And that's why I think if even once a week, if you guys provide reporters like, information about what you guys perhaps do in seminars to talk to survivors, to talk to victims. I know some of them are afraid to show their faces, but just to hear their voice and hear their situations, equal means so much to them. And then they could go and talk to their friends about it. And then that's how we can somehow, somewhat help those who are being victims of domestic violence. And I feel like that's one of my biggest passions, to be honest with you. And I want to talk a little bit about what I would like for organizations to talk to us about. And prevention. I think prevention, it's never old. Prevention is the main thing that I think will stop this trend of women being abused And we hear a lot from viewers, like, you know, I'm in this relationship, I don't know how to get out. So I think prevention will make a big difference and help these women fight through, you know, avoid the situations that they might encounter later on in life if they decide to keep this relationship. Also, resources for survivors, for women that are trying to get a job, trying to better themselves. So I feel like if organizations help us out with this information and perhaps having seminars with viewers, maybe once a month, I think it will make a difference, because we just get so many calls and so many messages on Facebook about, you know, I don't know what to do, I don't have money, what if I go to a shelter, I have 2 kids. So those are the kind of scenarios that we often see. And I feel like if we can do it, that will make a big difference. So right now, what Univision is looking for to cover at this moment, like I was mentioning before, my job has been to question the governor about what he's trying to do to help out the Hispanic community. So right now, we're a little, I will say, frustrated, just because he did mention that he was gonna give out this cash to the undocumented families, but we don't know when it's gonna happen. We don't know if it's gonna happen. He did say he was gonna give us out the information this week. Well, it's almost the end of the week and we don't hear anything. So perhaps next week. So I just feel like, I mean, do you really care about the undocumented people? Or is it just something that you're just saying so you can look nice on TV and be like, I'm with everyone? So that has been my job this past weeks, questioning the governor about, okay, you're gonna help the undocumented? Well, we wanna see results. We wanna see actions. We don't wanna just hear you talk every day at 12. You were gonna say something, Alejandra? Oh no.
I was gonna wait for you to finish because I have a question for you about what you were just saying.
Yeah, go ahead.
So yesterday we were hearing from journalists, sorry, not from journalists, from legislators. I was thinking of Durazo and Reyes, who both told us, especially Senator Durazo said that now is the time to speak louder about our requests, about the needs of the communities we serve. It is about making sure that our testimonials showcase these dire needs of immigrants, undocumented immigrants. And I'm sitting here struggling with the challenges that a lot of preventionists have when working with journalists. And you and I have talked about this, where there are times when journalists want to showcase, as Pam was showing in her presentation, the homicide, right? The crisis, the people suffering. And as preventionists, we speak about also this like waterfall metaphor that most folks go down to figure out why, the people that are drowning, and you want to hear their voice and put the microphone in their face. And preventionists go around the waterfall and figure out, why are people drowning? Why are they falling? Are there not enough signs? What can we do to prevent this? So we're solution focused. And sometimes we run into this barrier of, we want to speak about the solution. Journalists want to speak about the problem, and we're not seeing the same thing. So right now, when we are in this crisis, how can we help each other reach the same goal? We want to end violence. We want to, as we saw in the chat, we want to help people stop normalizing violence. So yeah, I said a lot, just thoughts. And also for Jessica, Pam, Carissa, what are some thoughts here? What can we do?
And I know it's really hard to stop violence completely. But I mean, and you do have a really good point. We have an amazing news director that we recently had him, I believe 2 months ago. And his main focus has been, let's present the problem, but let's present the solution. So we are doing stories that, yes, we're not showing just the problem, the person crying, or the person whose husband was killed, but we are showing the solution. So let's say a homicide story. What we do now is, and we try to address the problem, but then we talk to the police. We talk to organizations. Hey, what are we going to do with the crime? It seems like crime rate, it's higher. For example, Stockton, they have it really bad. So we want to know if they have a task that it's going to enforce, it's going to make streets safer. So that's what we're trying to do. And with coronavirus, it's a great example. So yesterday, I had this guy message me on Facebook. He told me that he applied for unemployment benefits and that it seems like the money that he had received the benefits already. He said that the system already said that he received the benefits, but he never got the debit card that you're supposed to get if you apply for benefits. So he doesn't really speak English. He moved, I believe, 4 years ago from Cuba. So he was like, hey, can you help me out? So I'm like, we've been getting a lot of calls from people saying EDD is not answering their calls. EDD, it's taking more than 2 hours to answer them. So I'm like, okay, so we have the problem. We have the guy who's willing to tell us his story, but at the same time, we're not just going to tell his story. We're going to talk to EDD. We're going to question them. We're going to ask them, why are they taking so long? At the same time, we're going to find local organizations that are helping them fill out these applications because they're complex. So yesterday's story, very informative. So we have the real story of the man talking to me, his frustration, he's dependent on this job. He has 2 kids. His wife is the only one working. She's a house cleaner. So, I mean, she's an essential worker right now. And we were able to talk to EDD, and EDD was like, you know what? We're just getting thousands of calls. And we understand the frustration. We want people to know that everyone matters. But we're trying to get more personnel to address this. So we have EDD side, but I'm like, okay, well, give me more solutions. I mean, I understand you guys are busy, but I keep pushing it. And I feel like as a journalist right now, you have to keep pushing it. Okay, well, give me another solution. So she said that people that already have applications, they have this settings on their applications once you go online, where you can actually chat with the person that did your claim. So I'm like, that's amazing. Some people didn't know about this. And then I reached out to a local organization, and they are working Monday through Friday from 8 a.m. until afternoon times, helping people that are having problems with their application, that they're confused, they perhaps don't speak English. So this was like a perfect example of just giving a solution to a problem. And that's exactly what we're trying to do now. And sometimes it's hard. I'm telling you, I've been struggling because I'm used to being out in the field. Now I'm stuck at home. And for me, sometimes I don't know what's going on outside. And I feel like this is the time when organizations and reporters should be a little more closer, because this is when we're getting stories that perhaps we don't even know it's happening outside, but because of you guys, we can find out and then do something about it.
So let's bring it back to the preventionists then that are here, and we have you here today, so we want to make sure and get these questions answered. So while I ask you a question, let me put it all out also to the preventionists. What questions do you have right now? How can we improve our relationship with the journalists that we work with? So again, right, so we're being told, be louder. How can we collaborate with our local journalists so that we're sharing the same story? Because that's what this is about, right? I'm also working on working with the EDD around the challenges, the barriers that folks face, undocumented immigrants and folks with limited English. So how can we work with you and bringing it back over to all other preventionists? What challenges do you face when working with your local journalists? And I want to bring Carissa and Jessica in as well. I know we have about 15 minutes left, depending on how folks want to wrap things up. I want to be mindful of that as well.
So I'll be really quick with my answer so everyone else can join. I think with me, just text me, call me, be aggressive. Like, I know sometimes I cannot do a story because we have a lot of stuff about coronavirus, but just give me let's be in constant communication. Send me story ideas. Hey, Yamara, this is happening. Hey, Yamara, this is happening. Text me, like pressure me. I don't mind at all. I like that. Just be on a constant communication with me. And I think that makes a difference for my reporting.
Okay, thank you.
I would just want to highlight,
yeah.
Just jumping right in. I know that we only have a few minutes, but especially with some of the questions that come up where we are asked, how do you tie in sexual or domestic violence to COVID-19? And the reality is that we have always been in a state of crisis. Sexual and domestic violence are, it is a crisis that we're working towards alleviating. And it's so important to remind people that sheltering in place is now 24 hours a day, but for many of these people, it's been 10, 12 hours a day. And so any of these issues that had already been existing are now being exacerbated. And preventionists who are doing the work, I like metaphors too. So when Pamela was like throwing out metaphors, I loved it. But you're at a dinner table and the conversation is around something. Are you going to bring up a random topic that's happening in another room? Or how do you come into as you are and be a part of that conversation? So if the conversation is around immigration, if the conversation is about race, class issues, because if there's something COVID-19 has done, although COVID-19 does not discriminate based on race, class, or status, it has certainly revealed the critical level of those disparities. And so you as the advocate, as the preventionist, really are in a position to say, hey, I am the expert in this area. I do understand that there are causes that we're overlooking here that we need other people to understand, and that these are the impactful ways that we are helping. And also pointing to some of the solutions or unintended positive consequences that have come out of this time. Improved engagement with the youth virtually, but those are some of the things. But speaking back to Yomara's point was, in this time, as we were exploring even what the Latinx community is experiencing, we were thinking, we need to meet our audience where they are. And these are families that are facing very unique stressors. And we need to be reporting to them and providing resources in such a way that it's like, meet them where they're at. These need to be Spanish blogs. These need to be understanding of those additional stressors. We need to understand the stressors that are unique to that community, whether it's gender roles, whether it's healthy boundaries, healthy relationships, and making sure that we're linking up with organizations that already are in communication with that intended audience, whether it's líderes campesinas, whether it's promotoras. But really, I really like the point about strategy is, what is the end goal? We want a safer and more inclusive community. We want communities where we are preventing violence from happening in the first place. Understanding really that what's happening environmentally is that there's this additional stress, and also coming in as the preventionist that you are and really standing firm in your expertise and sharing that. It's like, we see that this is an ongoing problem. It is not new. Here's what works for us, and here's how we can continue to work with you. So I think that's a first piece, but also in working with the journalists going back, it's just, hey, this is the impactful story, but also this is what we're doing. These are the resources. This is why it's so important that we keep working in this direction. But yeah.
So exactly along those lines, we know the disparities that exist. The lack of access to economic benefits, the lack of access to housing, the financial dependence on a partner that makes more money, the privilege. We know this, right? We do this for our work as preventionists. COVID has come to highlight these disparities, to bring them up to the forefront. So again, the question I have for Pamela, for Yomara is, we know this isn't new. However, when we reach out to journalists about wanting to share stories of how we can prevent, it normally tend to flip it on us and bring it back to the number of folks that are in shelters, and they take it to the crisis. We've been in crisis, as Carissa just mentioned. So working with journalists, reporters, and Yomara is here representing the Latinx community. We're also working with Korean immigrants, with immigrants from all over sorry, I don't know why I was thinking about the organizations that we have here today. But we have immigrants from all over the world. How can we, again, bring our story back to prevention? How can we sell it to you so that you hear it and say, oh, I want to go there?
Let me answer that. Give me a minute. Someone else can answer first and I'll go second. I want to think about this.
And Pam, too, if you have any thoughts here. And then for other folks, if you wouldn't mind, we're in our discussion section. Turn on your cameras, unmute yourself if you have any specific questions that you want to ask at this point. Again, our community partners are not closed. They're functioning differently. The barriers are showing up even more than before. How can we sell our story of prevention to journalists, to reporters, and stay focused on prevention?
So I feel like for us to be able to do something like that, what will be important, and this is me just thinking out loud right now, so perhaps having like a seminar about prevention. Hey, we're going to be talking to, it's just going to be like an open seminar for whoever wants to join on Face Live or whatever it is. And we want to, you know, talk to the community about prevention and, you know, how we can kind of help people out. So having that event, let's say, happening tomorrow, we can perhaps do that story today, talking about prevention, perhaps have a survivor, but mention about tomorrow's event. That way people can be more engaged, and that could be a solution because we're gonna have an expert tomorrow talking about prevention, and perhaps they wanna share their story with you. So I think that will make a difference when it comes to doing a story about prevention, that we can be able to find that resource tomorrow for them, like that solution. We're going to have you or whoever else is going to talk about that tomorrow on Fakes Live with them. So I think that could work for us at Univision.
I see Lisbeth mentioning survivors sharing solutions, possibly.
Yes, that helps a lot. And I'm sorry to interrupt really quick. I'm sorry. I just feel like, you know what I've noticed? I've noticed that when we have a survivor to talk about her story, it encourages people that are victims to talk and come forward and share their story as well. It kind of gives them strength. And I think that works a lot. Now, sorry, you can go ahead.
No, of course. I've just been internalizing everything you've said. So two things, or a couple things. So, Pamela, I think you really illustrated this beautifully. You know, we always say reporters don't tell issues, they tell stories. So one of the questions that we think about a lot, and I know I'm preaching to the choir here, or whatever metaphor you want to use. I use a lot of metaphors. Is thinking about, you know, how to make prevention newsworthy. And that's a question at all times, in my experience, because prevention is about the absence of something. So telling that story is a lot harder. And I think, you know, no matter if there's an event of some kind, whether virtual or otherwise, that can hint on that, whether there's new data that can be used, whether there's a story, you know, whether there's a way to, I'm trying to think of some of the stories that I've seen and done recently, whether there's a way, and I would say this is me sort of speculating, but, you know, we're in a moment where conversations about prevention writ large are very much on the public consciousness in the way they weren't before, because prevention failed, right, in a very, very big way in our cultural moment. And so I would also think, you know, one of the big things is like irony or kind of contrast. Are there ways to highlight, you know, we're in a moment where we're seeing what prevention failure looks like, but here in, you know, Alameda County or wherever else, we're trying to prevent the next wave. Or, you know, we're trying to take action against the next wave of an epidemic, and that epidemic is blank. So I wonder, too, if there might be some ways to think and talk, you know, in the current moment as we're experiencing what happens when prevention fails or is ignored, whether there might be some kind of news hooks around irony or contrast or things there as well to highlight. because that's something that's been coming up for me a lot. And, you know, as I said when I was talking and thinking about the values that are resonating with people right now, we're seeing in a very tangible way what interconnection, what community action, what the value of prevention looks like as it relates to COVID-19. And there might also, I would think, be ways to think about drawing lines. The other thing I would say is to it, you know, as many of the non-members have said, it's been a crisis, right? It's just kind of bigger now. So I know that this is always an issue, but I think my takeaway point would always be to thinking about ways to make prevention newsworthy. At UMSG.org, we have a kind of a worksheet of the components of newsworthiness, the elements of newsworthiness, and I talked about a lot of them today, but things like an event, breakthrough, release of data, you know, there's a celebrity, you know, hook. When Alejandra and I were talking about this a little bit, I was mentioning, you know, that Rihanna had given so much money, and Alejandra's immediate point was, okay, but like when a celebrity gives money like that, are there ways to talk about pivoting that conversation to the value of prevention as well, or what that money could have done in a preventive context as well as support for survivors. So piggybacking or taking advantage of stories that are already in the spotlight, and then using that attention to shift the focus to, you know, we're talking about these numbers, this incredible figure from the WHO about the spike in domestic violence, and you know what's happening locally and in California and in other places to bring those numbers down, to flatten that particular curve through prevention. I'm happy to share that resource with folks. But I would just think about, you know, the ways of making it newsworthy, and also tying into a moment where we're talking a lot about interconnectedness, and where people are getting a very clear image of why prevention matters in their own lives, and perhaps the ways they didn't before, although in that context, really around this pandemic that we're in the midst of.
Absolutely. So folks, I know it is time, and I want to keep hearing. So if you are interested and able to stay, I would like to invite you to an extended session with Carissa and Jessica, so that we can keep having this conversation. And we are going to regroup with the experts and think about how do we set up a webinar on developing your communications plan. What does that look like? But for right now, especially focused on how do we make these adaptations now, I would like to pass the mic to Carissa and Jessica.
Yeah, thanks so much, Alejandra. Let's see, I hope you can see my screen here. And of course, I always select the wrong option, but it's almost like a nervous tick, but great. So yes, with the bit of time we have here, we'll just go through this a bit quickly. Can you see the slides? Okay, great. So yes, we'll try to make this as brief as possible, but we certainly want to touch that point about prevention. So I'm Carissa Gutierrez, I'm the communication manager at Calcasa, and I'm joined by Jessica, or Jess. So we're excited to speak to you about adapting your communications during the COVID-19 pandemic. So we certainly would like to speak to you about that, Jess.
Yeah, I'll go ahead. Hey, everyone. So one really helpful item that I've had in my brain since attending this media seminar last year was that journalists want to elicit emotion from our audience. So basically, she said, think of all of the Facebook icons that you can use to react to a post. We want people to feel one of those. And I want you to be very clear with me how my audience is going to feel. And so whenever I think about pitching a journalist, I say, oh, your viewers will feel inspired by all of the youth speakers at this rally today. And so that's why I put, there's so much to love about prevention, because prevention is inspiring. That is the emoji reaction that I often think of when I think of prevention. Because even in this time, time of COVID-19, it's very important to keep people inspired on the solutions, on the work that's being done. And in this same vein, think of, all of the impact stories that you already have. You're working with the community, you're working with youth. Even if you can ask them to contribute to a shared Google Doc, that would be amazing. And then you can really have some story elements to send to journalists when there is something newsworthy. Next slide, please. So my thinking has kind of evolved around talking points. I used to type them up for my executive director to use every single time. And she was our spokesperson. And now we've kind of, as an organization, evolved and we're thinking, okay, talking points can be really helpful when you're discussing something technical, but also remembering what Pamela said about the importance of reinforcing our values. And this is where we get into authentic messengers. We want to be engaging people. We want to be sending folks out to be interviewees who have a real story to tell that is personal, but also connects with our work. And that's where we see this authenticity. We can reinforce our values the most effectively that way, and we can really connect everyone. We can connect these stories to create that cultural change that we really want to see. So don't worry if you don't have talking points. The most important thing, though, is thinking of the values you want to reinforce and your authentic messengers. Next slide, please. One example of this is our Orange Day rally, which I just really want to thank Yomara for her consistent reporting on this. Like every single year, they've been the station to come out. And I even want to say they've been reporting on this most effectively year after year because they actually talk with youth. We get parent and guardian permission first, and they get their perspectives. So this was not something we always did. We started with Orange Day as something that was primarily focused on advocates and preventionists talking about their work. And then we would have legislators too. But in the past 2 years, we have had youth actually be the lead speakers with legislators using their own privilege to affirm what they're saying and to support them. And that actually helps draw media to the event saying, oh, we have some really important speakers here. We have legislators, but also they're elevating the most important perspectives of the day, which is youth. So that's one example. You can strengthen your own story by inviting parents and educators who can speak to the benefits of prevention here. Next slide, please. And I think, Carissa, your turn.
Sure. So the initial pitch, right, just kind of bringing it back to this conversation that we've been having for the past hour and a half is that how do you then pitch to leadership or to individuals who are in those positions to help you advocate? And we have to remind you that preventionists can effectively tell the story of your organization. You are the expert in what you do. So I just really want to drive that point home. And you have this ability to mobilize your community members. You already do it, whether it is through the way that you're reaching out or engaging your community, but really seeing the media as sort of an additional tool that helps to amplify that work, have the media work for you. And so to do that, there are certain pieces that you need to be providing to the media so that they can do that. So it is as listening to Yomara and listening in and seeing, that's the hook. That's what you're looking for. Let me make sure that I can fit that frame and move forward with that. But I know that
sorry to interrupt, but Yomara has to go for a story. Thank you.
I know, I'm sorry to interrupt, but thank you so much for having me here today. I learned so much and I got to meet wonderful people, and thank you for what you guys do. Honestly, it means a lot. And I'm gonna give Jessica my information so you can provide it to everyone. And I'm here if you guys have story ideas or issues that you guys think it's important for us to obviously bring out there into the community, and of course, find solutions for them. And thank you so much, and stay home and stay safe.
Bye, Yomara. Thank you.
Bye, Yomara.
Thank you, guys.
Thank you. So yes, but just wanted to move on to a few of the other points. And Jess, I don't know if we have time for asking this question, but maybe in the chat, if you wanted to mention whether you have engaged in media advocacy for your organization, please interrupt me because I can't see the chat right now. But if there are questions that come up, please do. But if you have in fact engaged in media advocacy or used the media in any way to help amplify the work you do, please share what that has looked like or when it has happened. The other important piece that's happening at all times, not even including COVID-19, is that this is always an opportunity to build a relationship. Whether the pitch is picked up or not, and Jess can speak to that, it is still that introduction, sending that email saying, hey, this is who I am and what I represent and what I talk about. And if anything ever comes up on your end or on my end, we should keep talking. So it's always an opportunity to form a relationship. Now, I'll briefly go into this, and I know that Pamela covered this a great deal, but once again, media advocacy allows others to carry your message forward, whether that is a policy, whether that is an activity. What is the ask? What is it that you're trying to get people to do? And really being very clear about that with the media. Understanding as well, and bringing it back to COVID-19, we have always been in a state of crisis. We understand you as the preventionist are the most adaptive person. You know that when a person comes in, it is no two cases are the same. And so you're able to personalize that experience and able to tailor the resources at your disposal to help the people in your community. So it's really being able to adapt any conversation or any situation to fit that frame once again. Also just being confident in your work and experience. There is an opportunity there to educate, and we encourage you to do that. And so this point was coming up a great deal in the past, like 15 minutes. But what does prevention work look like in your organization? We talk so much about prevention. What does it look like? Is it working with youth? Is it hosting a workshop? Is it sharing a resource? Is it hosting a workshop? I already said that, but clearly I'm a little brain fried. But please share that in the chat. What does prevention work look like in your organization? And Jess, what has that looked like for you as we're having these conversations? People ask us, what is prevention work? Yeah. So, or Alejandra, actually, can you give an example or two of like what that has looked like?
Let me unmute myself, sorry. For me, definitely, with speaking with Yomara, we've been doing a lot of the work on strengthening paid leave, especially for undocumented immigrants and the barriers that exist. And I can't take credit for it, but we just learned last week that the EDD now has the application in Spanish, something that has taken so long. We've been talking about it every single time we do a session on the barriers to paid leave, which paid leave does help strengthen healthier relationships, fosters financial independence, gender equity, all of these other items. So showcasing that, and now we're going to be doing some of the work with the Work and Family Coalition on highlighting the win of having a Spanish speaking or a Spanish application. And again, we can't say we did that, but together our voices are louder. So the fact that the EDD kept hearing that this is a huge barrier for folks, and they did it. They got the Spanish one going, so hopefully the other languages will also follow.
Yeah. And what I love about that example is exploring the intersectionality between domestic and sexual violence and other real stressors that are happening in our environment. It's making that connection. It's understanding that sexual and domestic violence are not siloed, that they are in fact a symptom of all of these other situations that play out in our communities. So being able to also attach that point of the prevention work that you're doing to a real issue that's coming up in our communities, I think is also important. And finally, how do you make prevention newsworthy? Yes. So once again, how do you tie COVID-19 to everything that you do? You have been tying, and you have this understanding, each and every one of these you preventionists and advocates, that there are certainly many things we need to understand about a household or about our environment that lead to situations where domestic or sexual violence can play out. And so highlighting that and saying, hey, these have always been the things we look for and we're trying to fix, whether it's financial stability, financial independence, or economic independence, whether it is healthier boundaries, whether it's addressing gender norms, whether it's addressing even access, right? Language access as a justice issue as well. It's the fact that you understand this, and now in this new situation that we find ourselves in, we are seeing this exacerbated, and you have this very real opportunity to advocate on behalf of the community that you work with. And so every time that you are talking about something that you're doing, whether it's, and I want to bring up an example that Tori put in the chat about community care that Sarah Orton, who is also a preventionist that works with all of you, has done, is that something like she launched this whole initiative with community partners around sewing together teal masks during this time. What does that do to challenge the children? It mobilizes children. It connects them to rape crisis centers and dual agencies. It shows us, again, that there is an opportunity for us to demonstrate the impact that our agencies have in our communities. And it also taps us again and say, this is not just an issue where someone who has experienced harm is then caught and brought to this location. It is, we should always be in direct communication with all members of our community, and collectively we work towards promoting community wellness. So once again, it's just showing those examples, but demonstrating how this connection, I mean, I don't know if you're seeing also what's happening in our media is that we're seeing a deluge of everything that's happening in relation to COVID-19, but we're also seeing an uplift of positive stories. So what are the pros that are coming out of this? These are also things worth sharing. You know, increased engagement with youth, increased engagement with parents who are on Facebook, who are online, who do have the ability to hopefully watch 5 minutes of a webinar or read a resource or have an engaging activity they can do with their child during that time. I think these are very important opportunities that we could be leveraging as well. Acknowledge good reporting from past articles. Absolutely. If we've been seeing anything, Time covered the issue of domestic violence a few weeks ago, and it's like, this is exactly the kind of reporting you want to see, and this is exactly the way that we should be promoting it. And there are elements of prevention mentioned within it, which was great. Highlighting, sharing, and once again saying, really taking control of the framing, or sometimes I use the term lens, but really saying this is the way we want people to talk about this issue and to be looking at it. So collectively tapping into that and making sure that we are all on the same page about how we view this issue. Refer to heightened risk for survivors right now. Yes, more often than not, you know, that question comes up. It's like, are we experiencing more calls? And it's like, well, what are the calls about? We actually saw a dip in the number of calls the first week that that sheltering in place was put into motion. And that was a huge red flag. We're like, we're not getting as many calls, but that doesn't mean that there are less incidences. What is happening? And then 2-3 weeks, we saw a spike based on our centers. And we're seeing, actually, they're asking about mental health services. They want to understand what kind of services we even have. So clearly keeping track of those trends are certainly things to report on. But sharing that information as well, and pivot to prevention. Always bring it back to, yes, this is what happened. This is what we can do so that it doesn't happen anymore. This is preventable. And really bringing it back to how you engage with your family, how you engage with your friends, how you check in on people, or how you even engage in a virtual space, because social media and these spaces are still very real spaces. And so there is still work and conversations that we can be having to alleviate a lot of that, what we call like exacerbating rape culture, or normalizing that way that we communicate with one another. It's really challenging in saying, you're home, you're online, you're seeing all this different content, you still are part of the solution, and here is how. And so say that you have interviewers lined up and ample visuals if print. So absolutely. So once you see something play out, EDD lines are long, voter registration lines are long. You know, spouses or children are at have a higher incidence of being unhoused, that sort of thing. It's like, how do you connect this with the work that you are doing? And making sure that you have someone lined up or a picture. And sometimes, in going back to Jess's point about story banking, a lot of our organizations do a great deal of blogging. This is a great way to start that conversation even with your staff. And I noticed in the beginning of the call, people said, I'm a staff of one. That's usually the case, but more often than not, you're not gonna get a communication staff. So your best bet is having a staff that communicates. And sometimes the best way to do that is to generate blogs. And somewhere in there, the communicator's job is really to hunt down or figure out through their lens, here's the story, there's something here, and pull it out. And really have that ready. So in case there is a situation that matches it, or you can link to it and say, this was our preventionist, this is my colleague who worked on this, we can bring this out and there's a story here. And so moving forward, and Jess, back to you. I know we have so much time.
Sorry guys, just wanted to say, I wouldn't be doing communications work if I couldn't take rejection. There is so much rejection, and it's okay. It's natural to feel discouraged, and I've gotten to the point where I'm not taking it as personally, but this is actually an opportunity to follow up. Journalists have so much flying at them all the time. And this is your chance to, you know, say, let's say they missed a virtual event. You can send them the link and say, hey, this is the recording. You can still view it. You can still use screenshots for a story. You can still interview folks. There's still time. And you can also ask them about what they're interested in reporting about, and really use the opportunity to start a conversation and build that relationship. And then most importantly, whenever you have news to share, contact the reporter. You want to be seen as the go-to when it comes to preventing sexual and domestic violence. You don't always have to have a press release. Sometimes they can take too much time, in fact. So sometimes I'll just send a quick email to a reporter. Sometimes I will text Yomada, for example, and just say, hey, we have something really important happening tomorrow. And that quick note, especially in addition to the relationship that you may have already built, can just reinforce that you can act quickly and you can be available for emerging stories.
Mm-hmm. I was just gonna...
I think there was one more slide on...
There was one more slide.
Ideas.
Yeah, I wonder where it went.
On my end that I can pull up.
Sure thing. I'm gonna exit.
Okay, just one more slide, and this should give everyone some inspiration on how practically you can come up with some ideas that will generate some news coverage. So just one sec.
Well, just as setting that up, thank you all so much for sticking around. I know I'm loving the chat. There's other items coming over my way as well. Thank you for your tips, your resources. We know that this is a very urgent conversation, and we're going to keep it going. There's folks that are still on. They're developing social marketing campaigns. They're developing, that are needing to adapt these campaigns during COVID. So I'm actually going to reach out to Patrick, who is on the call right now, to see if we can maybe bring other folks in that can help us with the communications plan and then the adaptations that we're having to make when businesses are closed.
Yeah.
Carissa, you can start with the...
Sure. And thanks for pulling that up. And certainly the inspiration for newsworthy virtual events. Truth is that we are constantly innovating. I think the role of the communicator is very strategic, but also incredibly creative. And so depending on the audience, it's the audience that we're trying to reach that really determines how we reach them. And in light of COVID-19, yes, you know, social media was always kind of seen as like part of the comms world, but we see it as a space. And it's like, how do we enter this space? How do we try to recreate some of the energy, some of the action that we do when we are in person or in any other setting? And so something like our, the partnership has traditionally, I think for 2 decades now, done a policy advocacy day. And then for ourselves, the CalCasa honored Denim Day and hosted a rally in Sacramento. We were gearing up for that. We're like, okay, we have the date, last Wednesday, April 29th. And then we received the guideline from the state that said, we're all gonna shelter in place. This is not gonna happen in a physical sense. And it was overwhelming that within our team, we said, okay, then what do we need to do to adapt? This is what we do. And so really what we brought together was we focused more on the opportunities, and we focused more on some of the innovative ways that we could share this information, but also understanding the way that we were providing that information. So we couldn't host a rally at the Capitol steps. But what can we do with a virtual space where we have this captive audience of people who don't have to travel to be there? And what would they want to know? And how could we be the conduit to provide that information? So creating a virtual town hall allowed us to tap legislators and people who otherwise would not have made time or could make time to be there. It also allowed us to really expand on the number of people that could participate. So traditionally we had a little over 100, 150 people, not the legislative meetings, but just for the rally. This time we had nearly 500 people who logged in at 10 a.m. sharp, and then we're able to broadcast onto bigger channels like Facebook Live, where we still are seeing 3,000 to 4,000 people are engaging with that video still. So they didn't have to be there. They're still seeing some of that. And so there were all these great opportunities to form that. And really using what we see in our space. It's like our Zoom background, right? was such like a small but instrumental piece in the way that we are conveying what we're doing. Very clearly, I pledge to end sexual and domestic violence, really using all of the tools at our disposal, encouraging people, you can't take a picture at a legislative meeting, take a screenshot of the legislative meeting you're in, share that, tag us, we'll repost. You create that energy within a social media setting. And so, but feel free to jump in. I think what we experienced was just this wonderful connection with people who wanted to feel like they were doing something to prevent sexual and domestic violence from occurring in our communities. And for a moment, or at least for a day, they were able to be a part of that. And even our petition link that we sent out, we were very clear that, hey, you tuned in for this town hall, you heard a little bit about what's going on, you can do something. And maybe you can also speak to the media advocacy aspect of that. We shared this event with journalists as well.
Yeah, and I absolutely think this can be replicated at a local level. This is your opportunity to engage educators who are already working with you on prevention. This is your opportunity to ask youth who are comfortable with speaking with media and get that parent and guardian consent as well, and really have them be the messengers about what young people are experiencing right now. I mean, all of it. There are so many different emotions associated with what we're all going through. There's the disappointment of canceled events like graduation. There's certainly loneliness associated with isolation, but there's community building too. Yeah. And I think that's where youth voices can be especially powerful. When you get everyone in the same virtual space, you can leverage the sort of like privilege, kind of like we did at the Capitol with policymakers. And when you send out your media advisory, yes, you can say, we have Mayor so-and-so, and we have council member so-and-so, and, supervisor, so-and-so again. And we also have youth speakers. So sometimes the kind of like fame of the local policymakers can bring in the journalists. And then now that they're there, you can actually say, and I have this awesome youth leader who wants to speak with you. And that's oftentimes how we shift culture, we share power. So that's one idea. A few other awesome ideas that we've seen from members are youth and PSA contests, art and PSA contests for youth. You can partner with local businesses to provide gift cards. This is newsworthy. I think you should get in touch with journalists about this and let them know it's happening. Provide those story elements that we talked about before. You can share the art, you can share the PSA with them. It can be broadcast even further in addition to your own social media. And then lastly, I think Alejandro was actually talking about this earlier, is just partnering with restaurants and grocery stores. I know it's an extra step that they might need to take with, adding in information, but I think this is a great opportunity to provide hotline information and also provide information about your prevention and education work. There are many parents who are doing grocery shopping and getting takeout at restaurants, and they have youth, and we all want our youth to learn about healthy relationships at this difficult time. And sometimes parents may feel like they aren't equipped to have those conversations. Sometimes, I think this is basically a good opportunity for you to say, lean on us. We can help provide that guidance. We can help provide information about inclusive sex education and provide your phone number for that too. So I think that is about it. And thank you so much, everyone, for staying on.
I do need to make a quick plug though. And it's as far as, and just seemed like really good timing, but we had launched a PSA sort of campaign called Bold Moves, which really focused on actionable steps that people can make in their everyday lives to prevent sexual and domestic violence from happening. And so a lot of these resources too, it's a great time to be sharing them and to be talking about them as conversation starters. How do we talk about people that leads to attitudes that then lead to a form of violence? And so these conversations are always happening, whether they're happening online or in person. And so being able to understand where those resources are and share them is also great too. But just wanted to bring it back to that point. But I agree, especially with restaurants and that sort of thing. I'm seeing a lot of mobilization in my community to post and say, this is newsworthy. Look at the way the community is supporting the people within it here as well. So thank you as well.
Thank you. I know.
Thank you both so much
about everything, and I just want to assure people too that in our follow-up email to you, we'll include the email addresses to all of the presenters, and of course, including Yomara, who said that you can contact her with questions and also pitch her for article ideas.
Thank you both so much. This was awesome. And I know we are over 30 minutes, and the fact that we are here and we're having this conversation. And I will say, Patrick Cook with CDC he said yes, he will join us. He is in to help us continue the conversation about how to develop a communication and marketing plan. How do you make adaptations during these times? So please reach out. Just a kind reminder that we are now meeting every other week, 10:30 to 12. Put it in your calendar. Make sure that it's there on Thursday. So the next one I think is the 14th. So every other Thursday, 10:30 to 12, we come on. We have conversations. Please send us information on what it is that is coming up for you. What are the needs, so that we can address these. We will do the best we can to bring expert speakers on and engage in a conversation with you all. So thank you again. Carissa, te voy a decir Carissa. Is that okay?
Love it. Yes. Thank you.
Carissa, muchísimas gracias. Thank you so much for being here with us. We love partnering with you. Jess, you are an amazing partner to work with as well. I hope that folks have access to a communications partner that they can run ideas off of. And as Jess just said, I'm going to use her words. This is a perfect time for you all to lean on us as well. If you have any questions, ideas that you're trying to figure out, how do you work with a reporter, a journalist, and you're not sure how to pitch it, we're here for you. Pamela, Mejia, Yomara are on, Carissa, Jessica. So reach out. That's what the Prevention Peer Network is about. It's about making sure that you know that you have access to folks that you can reach out to anytime. We are texters. We're okay with email. You can send us a DM through Instagram or Twitter, whatever. We are here. So reach out. Wishing you all a safe and healthy rest of the week and weekend. Thank you so much for being here with us.
Bye, everyone.
Thank you. Thank you, everyone.
Take care.
Thank you.
Let me